On this special episode of the Stay at Home Nurse podcast, we have special guest Teresa Sanderson, an out of the box thinker who will share with you how she grew her hospice agency to $3 million using CE credit. She now teaches other nurses how to become CE providers and has a passion project called Nurses Feed Their Young. Welcome to the Stay at Home Nurse podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle, whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. So this week we have a special guest, Teresa Sanderson. And Teresa, if you don't mind, take a minute and introduce yourself to the Stay at Home Nurse podcast listeners.
Oh my goodness. Well, thank you so much for the invitation, the opportunity to be here. I am a registered nurse of, goodness gracious, more than 30 years. And these days I work at home as a nursing continuing education consultant. I am a sales and marketing trainer and founder of the Nurses Feed Their Young movement. Like you, Deanna, I am an associate degree RN, and every time I think I've ridden that little degree as far as it'll go, new opportunities have opened up for me. And so today, after working in traditional roles for probably 25 plus years, I'm really blessed to be able to enjoy an entrepreneurial lifestyle based out of my home and traveling and just doing nursing differently.
So just off of that introduction, I think I could go off on so many different directions. We could probably talk for an hour easily, but I don't want to miss the opportunity to acknowledge the part about the associate degree nursing, because I think it's so important that we let other associate degree nurses know that going back for additional education is definitely an opportunity that you may want to do, but you don't have to do to be successful. So
Exactly.
It's kind of like a little bandwagon I like to get on every once in a while, but I'm not going to get in on it right now. But just to let you know, Teresa and I have both been very successful with our associate degrees.
Mm-hmm.
And you don't have to go back to school to get a business degree to start a business. And
Amen.
to that, I want to ask you, I think that's a great segue into, tell me about your entrepreneurial journey. Where did you start? I know you had a hospice agency, and that's a very interesting story that I have not heard. So I want to hear about that.
Well, all righty then. So the hospice story began when I was working for the local hospice agency in my area in Northeast Kansas, and I was a novice hospice nurse. But I am a lifelong learner. I always dive in deep when I'm working or doing anything so that I can serve better. I can serve the clients, the patients better, and maximize the resources. I mean, that's case management too, right? Because I'm a case manager. So as I learned, that hospice is supposed to be really attending to the spiritual and mental, emotional, and other resource-related needs, I was working for an organization that didn't employ, for instance, full-time home health aides, didn't employ a full-time chaplain, didn't employ a full-time social worker. So in my opinion, they were very lukewarm in their approach to delivering hospice care. Yet I remember the billing clerk saying, "Oh, time to bill again, for hospice." And that it rubbed me wrong. It just really rubbed me wrong to hear that. And so I would go home and I would, lament to my husband who was an independent businessman, by the way. He was an independent photographer. And so I would go home and lament to him and just say, gosh, we could be doing so much more for these people. They don't even know what they're missing. They're so grateful for what they get, but they don't know what they're missing. And he would say, "Well, you just need to start your own." And I'd say, "You don't know what you're talking about. You have no idea."
He made it sound so easy. Just start your own.
Yeah. I was like, "You got to be crazy. You don't know what you're talking about." And so anyway, I would come home and have the same complaints and the same lamentations, and he would give me the same answer. And so finally I decided, well, maybe I need to kick the tires, So I looked up the Medicare regulations. I mean, this is literally how grassroots it was. It was just me and a computer. I did a Google search. How do you become a hospice provider? Took me to the CMS website. I began downloading the tools and the forms, looking at things. And the very first thing that caught my eye was this regulation that said home care agencies and hospice, and this is back in 2004, needed to have a letter from their bank indicating that they had at least $250,000 in reserves before they could start this type of business. And I said, well, if that's the case, I'm out. There is no way that is me. And there was a phone number to call, if you can imagine. There was a phone number to call. And I picked up the phone and I called and I said, I'm seeing this requirement, and I don't have that kind of money in the bank, to say I can just put over here for my hospice. And she said, I'm so glad you called. That was lifted within the last month for hospices. It still applies to home care agencies, but it no longer applies to hospice. So it's a non-issue for you. Yeah. And one by
perfect
one,
timing.
Every barrier that we encountered was lifted and just removed. And so, I was deeply in prayer at the time. It was a very spiritual experience because this was what I was going to dedicate as a ministry, right? And this, if I was going to do it, I was going to do it for the glory of God, and that was it. And so, that's how things happened. And lo and behold, so within 6 months, I would come home in the evening and work on my policy manual, and I would, print some brochures from my bubble jet printer and all of these things, right? I mean, literally started the hospice on a $6,000 shoestring budget, able to stock a tiny little supply room, have desks in an office space, and, contracts with all the necessary providers. But there was no $10,000 fee for a survey back in the day either. Today, I understand just for a surveyor to come out, a provider will pay 10 grand.
Wow.
And so I literally just called and said, hey, I'm ready. I've got my first patient.
Nice.
And they came out.
Well, how did you find your first patient? Because that's always interesting, is how to find clients. That's everybody wants to know when they're starting a business. How do you get clients?
It's my medical director.
Okay.
Yeah, I had to have a medical director. And the cool thing was that he and I had worked together on a case when I was with the Lukewarm Company, who was somebody near and dear to him. He was not my first choice in a medical director, but he ended up being the best choice by far because he is very well known in our area, very well renowned, had an excellent reputation, wasn't the youngest guy on the block, so he had years of wisdom and those kind of things, and was still very open to just really learning about hospice. And in his heart, when I asked him to be my medical director, we had never met face to face before. And he said, well, I'm intrigued by the idea. I said, let me call my insurance company and see, what the liability's like, what they can tell me about this. And he said, I'll give you a call later and let you know. He called me later that afternoon and said, I can do it. I'll serve as your medical director. Wow. And we just hit the ground running. And that's the thing, though. I think, we have to have the confidence and just understand the numbers that I interviewed 2 other physicians who said no, before I talked to him. And I remember my husband said, so the next one's your yes, schedule it. Because I was feeling really kicked,
Right.
I was feeling really down about it. And he said, well, the next one's your yes. And sure enough, everything lined up and was just fantastic. But so we started the hospice on $6,000, got our first patient in a week. But I have to tell you, that first day in the office, phone wasn't ringing. You have a brand new business. Nobody cares.
Right.
Nobody cares until they know, how can you help me? What do you have for me? What's in it for me? That's what everybody's always looking for. So I remember it was just eerily quiet in the office. And so that afternoon, again, me and my bubble jet printer, I made up a lot of marketing packets and just some really standard blue folders, put some stickers on them from my company. I made up a dozen of them, and I went out the next day and I made 12 marketing calls and just called on people and let them know what I was doing. And these were hospitals, long-term care, assisted living facilities, any place I could get in and just at least drop off a folder. And then people started talking. But that first week, it was Dr. Epley who really helped us get started. But very early in is when I decided I wanted to be a nursing continuing ed provider. And that's because length of stay on hospice was only 3 days in my area at the time, designed to be a 6-month benefit.
Right.
And yeah, just crazy, isn't it?
Yes. I've worked hospice, and that's one of the saddest things is when you get a patient that's like imminent and you're like, we could have done so much to make these last couple months really, the most that they could be. And
Exactly.
yeah. So I know one of the things that I hear about is how you started with your shoestring $6,000 budget. Is that right?
Yep.
And you grew it to 3 million,
Yep.
and you used nursing continuing education. So please enlighten us on how you did that.
I love that. I love that. Yeah, that's one of my favorite things to talk about. And one of my mantras, Deanna, is dare to do nursing differently. And I think, we have to, especially as entrepreneurs, we have to be willing to think outside the box. And I knew with that length of stay being 3 days, the median length of stay, that if I was going to impact length of stay, I needed to provide some massive education to healthcare providers about how to utilize the hospice benefit. So with that said, we became a nursing CE provider through the state of Kansas within 6 months of opening. And I prepared an educational calendar and I gave it away. I would go into every facility, every hospital would get their entire group of case managers and discharge planners together for a lunch and learn with me. I didn't even have to bring lunch. I would just provide the education, and they were my captive audience, and they had wonderful questions, and they learned what my patients looked like. They learned how hospice helps with dollars and cents and so many other benefits to patients and families who would otherwise price themselves out of the idea that they could have a nurse come to their home, right? They learned how it was paid for, how to utilize it, how to make a referral. All of those things are what I taught them. So it was basically Hospice 101. But I also taught them how we managed pain, how we managed symptoms, what we did for spiritual care. And these were all individual course offerings that did what? They allowed me to come back month after month after month. Every gatekeeper would smile and hold the door for me at the physician's office. I never had that stigma of being just another marketer, with a bag of cookies or bag of candy.
Right.
It was never that. I led with massive value, differentiated myself from every other hospice provider in the area. And that was worth its way. I mean, the ROI for me, people ask me today, how much money can you make as a nursing CE provider? I said, I don't know what to tell you. Mine was worth $3 million a year. It's all depends on how you measure your ROI.
Right. And I think one of the really important things to, there's a couple really important things that I think we need to kind of like focus on. If you've ever sat in a doctor's office, and I had with my children in the pediatrician's office, and you're in there for quite a while, and you see a rep for something, whether it's a drug rep or some rep for something, sitting there with their little briefcase waiting to be let in. And so you had the golden ticket because you had an appointment and a set time. So you weren't sitting there all day waiting to be seen and waiting to let in so that you could talk to the doctor while he was distracted and trying to go from patient to patient, chasing him down the halls to try to get 5 minutes of his time, or while he was chewing down some food or waiting for a return call. You had his undivided attention and his staff's undivided attention. And you were invited at a specific time, so you weren't wasting all day. It was like, I'm going to go in, I'm going to provide this, and I'm going to leave. So that's right there. That's very impressive. And you had something that you wanted to add to that?
Yeah, I was just going to say, I have to be honest and let you know, I didn't focus so much on the physician. I did talk with physicians, but they weren't necessarily my captive audience. Who I was really wanting to talk to were the nurses who picked up the phone on his behalf to make the referral.
Awesome.
You have
and
to
who had his ear and the one that was going to say, maybe this patient is ready for hospice.
Exactly. And so that was really, this was nurse to nurse communication, and it was so powerful. And when those nurses felt empowered to do something positive for the patients they were serving, who were being told, there's nothing more we can do. I really hope one day that becomes an obsolete statement, because there's always something we can do. We just may be pivoting to a different aspect of care.
Yes. When I worked in hospice, it was always so sad because they would say, like, well, the doctor said there's nothing left that we can do. And the patient felt out of control. And my thing was always to say, well, you can control how you want the end of your life to be. You couldn't control so much of it. You can't control that you have this disease. You can't control that it may be what ends your life, but you can control how you want to live the next whatever remaining time you have left. Because some people, it was like treatment to the end. Some people it was they want to just enjoy time with their family. Some people it was pain and comfort was the most important. So once you knew what was the most important to them, you were usually the only person listening. That hospice nurse was the only person listening to the patient because everybody's listening to the family who's over speaking for the patient.
Right.
And they're listening, the doctors aren't really listening. So, hospice has a special place in my heart because it really is, it's case management. It's case management, and it's a very specific kind of case management that's very much needed. Another thing that I noticed you talked about was the amount of money you can make on a continuing education company. And what I love about what you did was you were so outside the box with it. Most people, like myself, I at one time thought that I was going to start like a Netflix model of continuing education where you pay like $9 a month and you can get all the continuing education you need.
No way.
What I have learned is nurses want free continuing education. They don't want to pay anything. They want it for free. So what you did was you found a way to have it for free. You were able to provide free, needed continuing education, because that's another thing that just kind of irks me is when you have only these big drug companies that are providing continuing education on some obscure disease that none of your patients will ever have, and you'll never need this information. And even if you did, it would probably be obsolete by the time that you did have a patient with it, because they have this rare drug for this rare condition. And I'm sitting there listening to that. I'm like, this is a waste of my time. But you are providing needed education, giving them, empowering them on this is how you can help your patients. And you weren't trying, it wasn't your direct model of I'm going to provide continuing education. They're going to pay $10 or $50 to attend. You were finding a way to make money by getting clients in the door. So I absolutely love that. You were thinking so outside the box. And everything as I follow you, I see that everything you do is outside the box, which is one of the things I really admire about you.
Oh gosh, thank you. That's so kind.
So let's go on. And what else would you like to tell us about that? Anything else?
I think what I would say is that the hospice grew beyond our wildest dreams. And, but what I would say to people is begin with the end in mind. Know what your mission and your vision is as you get started in a business. Because what I see happening a lot of times with new nurse entrepreneurs is that you end up creating another job for yourself. And we don't want to be in that situation when we start a business that we've just created another thing that we can't stand. We're trying to create something new. So it's really important. And I think even today, you touched on an important point that as associate degree nurses, you and I have been very successful. And I know many other $1 million ADNs, right? I'm sure you do too.
Right.
So I think it's important to know that while additional nursing education is not necessary. I mean, if you want the prescription pad, if you want to be a nurse practitioner, if you want to do those things, then absolutely education is a path for you. If you want to start your own business, though, you've got a wealth of unique experience and wisdom that you've amassed over time that you can now package in the form of continuing education or coaching or mentoring or precepting, and create your own brand and sell what you know. That's what I would say to that. But it would be important to invest in, if you're going to invest in anything, it's business coaching, because that's the piece that nurses don't have. So rather than spending your hard-earned dollars on additional education that's just going to teach you more nursing, learn the business skills that you need to grow your business.
Absolutely. And I didn't know you were going to say that, but I have to agree with you 100%. And it's also another one of my pet peeves. That's like a nurse will think for 5 minutes about going back to school for an additional degree and spend anywhere from $10 to $40 to $60,000. And that's going to give them, I don't know what it is now because I've been out of the hospital for a while, but when I was in 25 cents an hour, if anything, I was going to get 25 cents an hour more. Now, even if that's, 10 times that and it's $2.50 an hour now, when you think of the time away from your family while you're studying and going to school and learning, and what are you going to do different for your patients based on that? And you may or may not, I don't know. But what I do know is you can spend a fraction of that to hire good coaches, to get courses, online courses for things. And I like to call it just-in-time learning. So what you're doing right now, if the next thing that you need to do is, talk to somebody about, the actually starting a business, is this a good business idea? Poke holes in it. Sit down and spend $500 or whatever it is to sit down with a consultant or a coach or somebody and get that information, because that'll take you so much further. But or buy a course. Like, okay, I want to get into this because the people that are listening don't know this, but I hope Teresa doesn't mind. When we first got on this call, I was telling her how I just got my continuing education provider, and it took me a week I had to stop everything else in my business. Everything else was put on hold. Now, I am blessed that I have other people that work in my business with me that could keep the wheels running, while I went off grid and spent a week to become a continuing education provider. And the caveat is, we already had continuing education for this with somebody who was my continuing education person, but she retired for the second time. She retired, started working for me, retired officially forever. And so I'm like, okay, she has it all there. All I have to do is resubmit it. No, this was 40 hours of my time that I will never get back.
Yeah.
And after about a week later, somebody sent me a link to Teresa's course page. And I have to tell you, I almost cried because I was like,
no.
I could have had all this information given to me step by step instead of me trying to recreate the wheel and waste 40 hours and all the things I could have done with that 40 years. But okay, I digress. Teresa, tell me about how you can save people like me from this terrible, and I've told Teresa too, I have like PTSD about this because it was so stressful and so overwhelming and so confusing. And I'm not stupid, but it was not written and laid out in a logical way. So I had to make it logical, which took a lot of time. So Teresa, please tell us what you do to help people like me.
Oh my gosh. Well, yeah, I am so sorry that you experienced that, first of all, but I do what I do as a nursing CE consultant, which is helping nurses, nurse entrepreneurs, businesses become nursing CE providers, or just add continuing education credit to their courses. And the reason I do it is because people want to be able to provide nursing continuing education, but being able to find information about that on the internet or anywhere is very hard to do. I've been there, done that. I know how hard it is to find the information. I've been a CE provider for at least a dozen years, and I have figured out the process of how to develop applications for people, how to develop CE courses. And so that's what I do. My company is all about helping other people become CE providers. Now, why is that so important to me? It's important to me because nurses are tired of what I consider the big box CE players, where you can get 30 hours for $40 every 2 years. And it is the most mindless, drivel, written words on a page, hard to digest. There's nothing transformational about it. And the ones that say no post-test required is just a matter of clicking buttons to get the credit hours so that you can submit for your licensure renewal. Well, there's nothing transformational about that. I'm sorry.
Absolutely.
And if it's, I don't care if it's $30 or $3,000, I am going to be hard pressed to buy that because in my opinion, it's junk. Sorry.
And, no, I totally agree. And I did, for the state of Florida, you have to take human trafficking. And so I had 1 hour, you need 2 hours. I had taken 1 hour at a conference I went to, and I needed another hour. So I went onto the provider website and I clicked and I purchased it. And there was nothing that I learned from that. I mean, absolutely nothing. And it made me sad because I think of all the nurses who this is what they get. Nothing. There's a reason why we are required to get continuing education so that we stay up to date and we can practice and keep people safe.
Right.
And the information that you're getting is not doing that. And I have a lot of pet peeves, it seems like, because I'm going to, and I'm really not a negative person. I'm a positive person. At least I think so, because I like to see nurses teaching other nurses. I don't want to see a drug rep. I don't want to see a business person. I want to see an actual nurse teaching other nurses. You have learned something in your years of nursing. And it's like mentoring. You can give back
Mhm.
to the next generation or to your peers by what you've
Mhm.
learned, and they can learn from you, and they can get that is continuing education,
Right.
not again listening to some about some pharmaceutical complications of some obscure drug that none of your patients are on. That's not going to help.
Exactly.
Yeah.
Exactly. Yeah. I talked with an interesting case in point here. I talked with a pulmonary support company. They provide DME, at-home ventilators, CPAPs, BiPAP, the whole deal. And I talked with the respiratory therapist yesterday who does their marketing, and she was saying, we're seeing a lot of rehospitalizations that are happening. We're seeing a lot of knowledge deficits from the patients and families because when they're in the hospital, they're on one device and they go home on a totally different device and they don't know how to manage it. And so they're getting into trouble at home and they end up with readmissions. I mean, this is meaningful nursing CE that this company
Yes.
wants to provide, right? This is a
Yes.
case manager's dream. How can
Yes.
we stop this cycle? So there are so many companies like that, and I'm super excited to have the opportunity to help them. I'm working with another company right now who it has a brand new blood culture collection device that's going to eliminate or minimize false positive results and all of these kind of things. But there are certain things that under the ANCC nursing continuing ed that I'll just add this as an aside, but if you are a brand or a company that actually owns or sells a medical device that's used in daily patient care, you would be an ineligible company to teach through the ANCC. Whereas in my opinion, this is vital information for nurses to have. I don't care
Yes.
what brand it is. It's important. This is keeping nurses up to date, right? And
Right.
sometimes it's going to come from the company. Sometimes it's going
Absolutely.
to have to.
Right.
So,
Because who knows
in any
more
case,
about it than the company that created it?
exactly. So I'm blessed to have tons of opportunities to work with wonderful people who are bringing state of the art, relevant, valuable, high quality nursing CE to nurses. That's the difference. If we just churn it out to spit it out and make a buck, we know what that looks like. But
Absolutely.
if we bring it to the table with intention and with purpose, we can make a difference.
We can.
We can make a
And
difference.
and nurses should be excited to learn.
Yes,
They should be excited to attend the CE because it should be something that they know is going to help them to help their patients. And
exactly.
unfortunately, we've seen so much bad CE out there that we're almost turned off and would rather sit
Mhm.
there and play Candy Crush on our phone while we're listening to it. We're not really listening because we know it has no impact on us or our patients. So
Right,
you are
right.
doing a really great
Mhm.
job of helping us to be able to, like I say, it's almost to me, it's like mentoring. It really is. It's like we need to be able to mentor, and this is a way to mentor that's
Exactly.
a win-win for everybody. So
Mhm.
the,
Agreed.
yeah, so I love that. Um, we're cutting close on time, but one thing that I want to make sure we hit on is your Nurses Feed Your Young. That's one of your passion projects.
It is. It is. Oh my gosh. Thank you for asking. I experienced the phenomenon of nurses eating their young, Deanna, when I was a student nurse. I didn't
As
even
did
get to
I.
graduate
And my first,
before.
it was mostly my first year of nursing, I think, but yes, okay.
Yeah, the hazing begins immediately, right? And in all my 30 plus years of nursing, I've never seen anybody really address this big elephant in the room that is this incivility among nurses that is almost just accepted, so much so that we have this phrase, nurses eat their young. And when I was a brand new nurse, I used to think, it's kind of amusing, I'm part of the nursing club. It's kind of a thing. But the more years and the more time I spent in nursing, now I hear that and it just saddens me. It really saddens me because here we are again in another state of nursing shortage, chronic nursing shortage. And the thing is, what the world needs to understand is that when I graduated as a nurse 32 years ago, we were already talking nursing shortage. There has always been a nursing
Yes,
shortage. And I'm sure
yes,
they talked about it before I graduated, right? Decades before. The thing is, the pandemic caused the shortage to just really exacerbate so much that all of a sudden the general public knows about this. The shortage knows about, how ugly things can be in healthcare. And, on the tail end, there's a lot of other things that are happening now, like nurses facing litigation and all of these other things. So what I really long to see is nursing elevate as a profession. We are professionals. We are not factory workers. We are not, we are very skilled in our caring profession, yet we don't communicate that way. So I think this shoots us in the foot a couple of ways. Number one, when we bring in new nurses to a toxic work environment, why do we expect them to stay? Why do we expect that? Why do we expect that we can bring in brand new nurses who are smiling and excited to start their careers, and we bring them in just to haze them? And when they ask a question, we say, nobody showed me how to do that. Why should I show you? Or we do the eye rolling and the heavy sighing when they ask a question, or I don't have time. You're going to have to figure it out. Wow. So I experienced this as a new nurse. I also experienced it as a travel nurse. And, when I was 20 years experience, 25 years of experience under my belt, I did some travel nursing in Kansas City, and, I'd get floated from my unit to a different unit. The same thing. I'm not a new nurse, but nurses eat their young because I was a new nurse to that float unit, right? So
Right.
You're already a nurse, you're a travel nurse, so you shouldn't have any questions at all. That's why they pay you the big bucks, you hear, okay? So here I am to help. I might at least not like to know where the supplies are on your unit.
Right.
That would be helpful, right?
They
I don't
didn't
need
teach
you
us
to
in the
hold my
nursing school
hand.
like where the supplies would be in every single hospital.
Yeah,
Yes.
I
Yeah.
mean,
In
it's
every
like
unit.
I don't need you to hold my hand, but can we respect each other? And, but that is so lacking. And so I really think nobody's addressing this. And healthcare administration continues to send out, pizzas to nurses who don't have time to eat them.
Yes.
And, I just think it's ridiculous. We throw the same things out there. We still are doing things like incentivized bonus shifts for nurses because the shortage is so bad, that nurses can always work for double time pay. You can always
Right.
get a double time shift. You can always get an extra $3 differential. You can always do this, but shame on them for doing that because nurses are already exhausted. Nurses were exhausted before the pandemic began.
Correct.
And so with all of the additional shifts and everything that was incentivized, here's what happens in the grand scheme of that is that nurses begin to plan that money into their everyday household budget to the
Yes.
point that they cannot get by without incentivized shifts. And so I say shame on the healthcare system for doing that to nurses, because that is exploitation to the nth degree, in my opinion. And I'm probably going to be very unpopular for saying that, but I don't care. I don't care. Yet the healthcare system is broken and nurses are suffering. They've been suffering a long time. So nursing culture is negative. We have the nurses eating their young thing, but also our work environment is very, very poor to where nurses feel unsupported. They feel unappreciated, and it's just a very challenging profession to be in.
And when you have nurses that are not coming together and supporting each other,
Mm-hmm.
you don't have one voice going to management and saying, we need this. So
Yes.
it's almost like as long as the unit is fractured, you can't
Mm-hmm.
get what you need.
Right.
On so many levels, nurses eating their young is a bad thing. And
Mm-hmm.
the most important thing to me is the patient.
Exactly.
And the patient is suffering when you're pulling a double shift, or you can't go home at the end of your shift because another shift called off because
Right.
that young nurse decided she just can't go in and face the bullying. And
Exactly.
yeah, you're getting overtime or maybe double time or whatever you're getting, but can you take care of that patient? And if that was your mom in that bed, is that how you are you the nurse that she would want? And
Mm-hmm.
that's always been, from day one. I guess it's just my personality. And I thought all nurses were like that they cared about the patient above everything else. And
Mm-hmm.
that means sometimes you have to get along with nurses you don't like because you have to be able to
Right.
give them a good report or get a good report from them or help them with
Mm-hmm.
something that they haven't done before so that that patient gets the best care
Right.
that they need. And
Right.
if we all focused on the patient and said everything through that lens of, is this the best thing for the patient? Is it the best
Mm-hmm.
thing for the nurses to be overtired and overworked? Is it the best thing for them to not be able to ask a question when they're not sure of something and maybe give a dose that they're not sure of
Right.
because they're afraid to ask? And
Exactly.
did you create that environment by not being the person that they could go to? So,
Right. Right. Can I
so I
share
love
just
that you're doing it.
couple
Yes,
of quick
please.
points?
Yes.
Okay. Sorry to interrupt you.
No, you're great.
Um, yeah, and that all of these things are what Nurses Feed Their Young, the movement is all about. Our mission is to infuse emotional intelligence into the everyday skill set of nurses and nursing leaders. And our vision is that when we do that, we will improve nursing retention, decrease stress and burnout, and improve the patient experience. So these are some massive, massive things that we can achieve without waiting for administration to give us the go ahead. What I really
Right.
love about the Nurses Feed Their Young movement is that each of us as individual nurses can decide to up level our emotional intelligence game. And so Nurses Feed Their Young has the tools and the training and the skill set available to train nurses. We can train healthcare organizations, and we are actually having our very first Nurses Feed Their Young conference in Kansas City this September. So I'm super excited about that.
Oh, that's so exciting. I love
Yeah,
that. I
you
love
betcha.
that. And again, my case manager hat's coming on, and it's like, when you were talking about all the benefits, one of the benefits is better patient outcomes. And if we want our hospital to make money, which we do, because the only way, I mean, there are hospitals that are closing.
Right.
It's not well advertised if you don't live in the local area, but there are
Mm-hmm.
hospitals that are closing, which means that nurses are losing their jobs.
Right.
And yes, they can go get another job, but maybe it's not as convenient of a location. It's
Mm-hmm.
there's a lot of reasons why that's not good for nurses. So if you want to
Mm-hmm.
keep your job and you want to be able to get a raise, you need to make sure that the patients meet their outcomes, which as case managers, we know this, but we don't necessarily know it as floor nurses, which is readmissions. Do they
Right.
have readmission within 30 days,
Mm-hmm.
readmission for certain diseases,
Right.
getting the patient out on time? And if there's a sentinel event, there's all these things that we have to look at as for patient outcomes. And if you gave the wrong dose of a medication, or you gave the wrong medication because you were afraid to ask, or any number of things that can happen, that may mean not just for you as an individual, but it may mean your whole organization. When this happens enough times across the whole organization, that
Mm-hmm.
organization cannot succeed. And we think of the
Right.
organization sometimes as the bad guys, the big, they don't listen to us. But again, if we can band together and we can come as one voice and say, we refuse, they did it in New York. They came together and they said, we are not
Right.
going to work these unsafe shifts and these
Mm-hmm.
unsafe staffing.
Mm-hmm.
And they banded together. So we are so much stronger when we come together. So I'm really excited
Exactly.
on what you're doing. And
Thank
yes,
you.
each one of us has an individual choice to make every day when we walk into that unit. Are we going to be somebody who uplifts the unit,
Yep.
uplifts the new student
Mm-hmm.
nurses, and as well as the new nurses on that unit, or are we going to be somebody who brings it down?
Exactly. Exactly. And I think that's so important. And also, you mentioned the banding together in New York and things like that. The emotional intelligence piece is vitally important for nurses, even when we do come together, because we have to be able to convey our thoughts, feelings, and ideas in a professional manner, and be able to articulate the points that need to be heard. And if we come at it with the eye rolling and the incivility and the bullying, nobody's going to
Right,
listen. We
right.
have to elevate as a profession if we want to make our voices heard. It's vital.
Well, I love what you're doing to help this. I love that you're having your first conference this year. How exciting.
Yes.
Okay, Teresa, before we leave, I believe you had a free training that you wanted to give to the listeners. Do you want to tell us a little bit about that?
Absolutely. Thank you so much. So, now you've heard my story of how I grew my hospice to 3 million with a nursing continuing education program. So I have a free training called How to Add Nursing Continuing Education Credit to Your Courses and Explode Your Business Growth. This is on my website at teresasanderson.com. It is a recorded video training. It's not too long, probably 25 or 30 minutes, but I would encourage you to take advantage of that so that you can see what impact you can have as a nurse-owned business, or really whatever kind of healthcare business you may be in. Really, nursing continuing ed is the best kept secret in marketing these kinds of businesses. So I would love to see you take advantage of that.
I love that. Thank you. And
Sure.
if you don't already know Teresa, she has a Facebook group or Facebook page. She has a LinkedIn and she has a YouTube channel. So tell everybody where they can follow up with you and learn more about everything that you do, both the nurses feed their young as well as the CE credits, and you help with marketing. You do help with a lot of different things. So go
I
ahead and tell
do.
everybody where they can find you.
Oh my gosh, thank you. Thank you. So on Facebook, I am just Teresa Sanderson. That's my profile page. My business page there is Teresa Sanderson Company. And my Facebook group is where most people like to land, and that is called Nurse Entrepreneurs Bedside to Business, no extra education required. So I would love to have you join the group. When you join, you actually get a complimentary contact hour of nursing CE credit. And when you grab my it's a free training called Assertive Communication Skills for Nurses. So just a bonus for hopping in the group. I am on LinkedIn as the Teresa Sanderson, and you can also catch me on YouTube at Teresa Sanderson TV.
Awesome. Thank you very much.
You bet.